Welcome to a new episode of Medicine in 3 minutes. We go straight to the point. The subject is briefly made clear and often illustrated. Let's start. Today's topic is Sjögren syndrome. Sjögren syndrome is a long-term autoimmune disease that affects lachrymal and salivary glands, can affect lungs, kidney, and nervous system. Epidemiology. Between 0.2 and 1.2% of the population is affected. Half having the primary form and the other half have the secondary form. Females are affected about 10 times more than males, and the disease commonly begins in middle age, but anyone can be affected. Without autoimmune disorder, life expectancy is unchanged. It's the second most common disease after rheumatoid arthritis. Autoimmune exocrine gland disease, and there is a lymphocytic infiltration. The exact cause is unknown. It is believed to involve maybe combination of genetic and environmental trigger, like virus and bacteria. Primary Sjögren syndrome occurs independently of other health problems, and secondary Sjögren syndrome results after connective tissue disorder. Sjögren syndrome may be associated with rheumatoid arthritis, systemic lupus, or systemic sclerosis. The inflammation that damages the gland is progressive. The disease progresses in 3 stages. Early, it's exocrine disease. Later, it's systemic or immune disease. At the end, it's lymphoproliferative cancer. Symptoms include Xerostomia, that means dry mouth, and dry eyes, parotid enlargement, dental caries, primary versus secondary, malarash with rheumatoid arthritis, and primary biliary cirrhosis, association with cancer at the end, lymphoma. Sand-like feeling in the eyes, dry eyes and dry mouth, dysphagia, difficulty swallowing. Diagnosis. Schirmer test measure tear production. Patient produce 1 of 10 of normal person in tears. A rose Bengal stain of the eyes. You stain the eyes to see small ulceration. Not confirmatory. Take a step further to make the diagnosis. Clinical picture plus antibody, ANA, anti-Rho or anti-LA, one or the other. Do biopsy only if you think something else. Do a biopsy only to exclude another disease. Schirmer test, rose Bengal stage, 3 stages, early, moderate, and late. There is no cure for Sjögren syndrome. Treat syndrome with artificial tears. Treatment is directed at managing the person's symptom. For dry eyes, artificial tears. Medication to reduce inflammation. Punctal plugs or surgery to shut the tear ducts. chewing gum for a dry mouth, sipping water or a saliva substitute, ibuprofen for joint or muscle pain. Avoid medication that can cause dryness, antihistamine. Remember, the disease progresses in 3 stages. Early, it's exocrine disease. Later, it's systemic or immune disease. At the end, it's lymphoproliferative cancer. Primary symptom, dry mouth, dry eyes, dry skin, vaginal dryness, chronic cough, numbness of arm, pain and fatigue, thyroid problem, increased risk of lymphoma in 5%. Xerostomia is dry mouth, dry eyes, parotid problem, dental carie, primary versus secondary. Think of malar rash for lupus or polyarthritic arthritis. Think of primary biliary cirrhosis. Association with cancer at the end, lymphoma. Diagnosis, Schirmer test, measure tear production. Rose Bengal stain of the eyes. You stain the eyes to see small ulceration. If not confirmatory, take a step further. To make diagnosis, clinical picture plus antibody, ANA and anti-LA, one or the other. Do the biopsy only if you think something else. Early stage, moderate, and late. Treatment is directed by managing the person's symptom. For dry eyes, artificial tears, medication to reduce inflammation, punctal plug or surgery to shut the tear ducts, chewing gum for a dry mouth, sipping water or saliva substitute, ibuprofen for joint or muscle pain, avoid medication that can cause dryness like antihistamine. There is no cure for Sjögren syndrome. Treat symptoms with artificial tears. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the button like and subscribe? Your comments are very welcome. Thank you.